One of the questions we get a lot is, am I a candidate for Invisalign? I feel like that question is almost not a fair question because the answer is almost always yes, you're a candidate for Invisalign or clear aligners if that's what you want. Now, what question we should be asking is what would be involved in treating my case with clear aligners versus what would be involved with treating my case with braces. So this patient wanted treatment. They wanted a clear aligner system. They didn't want to use braces. Some people, when they look at this, they might just tell this patient that they're not a candidate because there are things about this case that are challenging as it relates to correcting with clear aligners. One of those things is what we call a maxillary cant, or a cant of the teeth, where when you look at the smile from straight on, you can see that the right side of the smile is higher than the left side of the smile. That is something that is very predictable and easy to correct with braces typically, especially when it's not the entire jaw and it's just the teeth. If you put braces on the teeth within a few months, that corrects out completely. With aligners, it is correctable, but it's a little trickier on how that's done. But she wanted aligners, and so that is the plan that we worked up for her. And we can see as we progress, we're not only going to need to correct that tilting of the teeth in the front, but we're going to need to broaden out the arches as well. You can see, especially on that left side, how everything is tipping in there. So this is what that looks like when we're designing these cases. We want to work through and we want to see these movements. You'll notice here that before we start moving those teeth down, we create some space for those. And again, there's lots of different ways to move these teeth, but we want to move them in the most predictable and quickest way possible. There's also some bumps on the back of these teeth. Those won't actually go on her teeth, but those are a feature of the aligners that helps us to move the teeth more predictably and help us to manage the bite so that your bite fits together after the teeth are straight. And so that's what we did. These are the clear aligners that she wears. This is her 5-month progress photos. So she's been wearing these aligners for 5 months. And we're not all the way there yet. This is where we started. This is 5 months progress. Those teeth are coming down. You can see how the teeth in the back are uprighting. You can see the attachments on the outside of the teeth. Those are used to help grip those teeth and make those movements predictable. And we continue to move forward. So this was, again, her 5-month mark, not 100% there yet, but we're headed in the right direction. And we continue to move forward. She continued to wear the aligners, and we continue to modify and adjust. Traditionally with clear aligners, what happens is every time you get through a set, a new set is made. But what we do in order to reduce your treatment time and to make your treatment as efficient as possible is that most of the time we will go ahead and just add to the stages, add to the aligners where you are to make the final movements that are needed. And so here you can see that the bite wasn't needed to be settled down, so you can see the movements that are needed. This is only going to take about 3 aligners, and she's at 11 months total right now. So she's going to go ahead and wear those aligners, and this is where her final result was in 14 months. So again, this is a patient that, originally would have likely been told, you're not a candidate for aligners. If you want aligners, most likely you are a candidate. Now, there may be attachments that are needed on the teeth. You might have to have an auxiliary here to correct this. There might be another appliance that goes with it. You might need braces on some of the teeth, but not all of them, or you might be in treatment a long time, depending on what you want to do. But that question, are you a candidate for aligners? If you'll wear them, then the answer is pretty much always yes. So if that's something that you want and you've been told that you're not a candidate, feel free to send us some photos or just come in for a complimentary consultation. We'd be happy to look at that with you and see if there is a way to plan your treatment in such a way that you can wear clear aligners and that you don't have to have braces on your teeth either for the whole time or at least not for all of the time. And again, we'll go through that with you in detail as it pertains to your case. Thanks for hanging out with us today. We appreciate you guys. Have a great rest of your week, and we'll see you next time.